Welcome everyone to our weekly Q&A session with Toronto's Associate Medical Officer of Health, Dr. Vinitha Dubey. Thank you so much for joining me today for our first session of the year.
Yeah, Happy New Year to you and to everyone watching.
Absolutely. Happy New Year as well. My name is Dilshad Burman. I'm a writer and reporter for City News and City News 680, and I will be moderating this chat today. If you haven't joined us before over the past 2-something years that we've been doing this, the way it goes is we collect your questions over the past few days for the doctor. She's never seen them before. We collect them via Twitter, Facebook, and our website, and then we present them to her. She answers them off the cuff. And if you haven't had a chance to submit your questions, you can still do so in the live chat under this broadcast, and we'll try to get to as many questions as we can. Now, we were away for 2 weeks, and so we have tons and tons of submitted questions. So we're going to start with those questions first, but feel free to jump in with your live questions. And then, as I said, we'll try and get to them, to as many as we can in this short 30-minute period that we have with the doctor. So, doctor, are you ready to go?
Yeah, let's go.
Excellent. Okay, let's jump right in. Let's start with Talia's question. Talia says, I am pregnant and waiting to get my booster. Has Omicron shown any signs of being more severe for pregnant women?
Yeah, I think it's actually the other question. Is there any indication that in pregnancy with Omicron, it will be less severe? And I think what we're finding with COVID is that it is more severe in pregnancy, and there's no reason to believe that even with Omicron, that being pregnant puts you at higher risk, even with this new variant. So absolutely recommend getting the vaccine if you are pregnant. I know it can be hard to navigate a booster dose, but trying to get one while you are pregnant for sure.
Right. Okay. And so, sorry, doctor, just to clarify then, in terms of, in general, COVID, if you do get COVID during pregnancy, it is considered to be, it generally is more severe or can be more severe, correct? Whether it's at Omicron or not.
That's right. And so I think that that's, what we're finding is that the people, even with Omicron, who are ending up in hospital or getting very sick are first off unvaccinated. So if you're pregnant and you haven't had any vaccine, please start your vaccine series, because that is definitely what we're seeing with Omicron, but also that those people with Omicron who are ending up very sick, even if they're vaccinated, tend to be older, have a chronic health condition, and pregnancy would be, again, in that category. Again, we've only had Omicron, it seems like forever, but we've actually had it for weeks and weeks. So we'll be able to kind of give more specific information related to pregnancy, but there's no reason why, if you're pregnant, you should feel like, oh, it's a mild variant, it's not going to impact me as much. Yeah.
Right, exactly. Okay, and then let's move on to Devin's question. Devin asks, are we going to see the breakdown of new COVID cases again based on vaccination status?
So I think there's a lot going on in terms of how we're reporting COVID cases. Certainly, there's been a big change in testing in terms of who is responsible for testing, yes. Who gets tested. And so that is going to change the way cases are reported. Now, when there is a case reported, unless it is in a high risk setting, so that means, a long-term care home related to a healthcare worker, for example, health units are not doing investigations for those cases. So that vaccination status information may not be as readily available. So we'll have to see. I know that there are a lot of changes that are occurring to the reporting. And so, we'll really have to see whether the data people can make those links or not.
Right. Okay. And then this is a PCR question. We get this often. Let's tackle it. Mr. Bridle says, what cycle threshold setting is currently being used for PCR testing?
So the cycle threshold is very much dependent upon the lab, the very specific one. It is often above 30, whether it's 30, 32, 35. Often it depends on the lab. On the conservative side, you could pick 35. I haven't quite seen much higher than 35 being picked. And what that means is that if it's a high cycle threshold, it means that the PCR test is likely to be due to an older infection and not from a recent infection.
Okay, the positive test result.
That's right. That's right.
Okay. So, doctor, just on the topic of PCR tests, we've seen a little bit of this going around on WhatsApp University, and there's been this forward that's been going around that the CDC is no longer recommending PCR tests as the standard test for COVID-19. And I think there's been some conflation about the data that they put out, because it says that it cannot, or at least what I've seen going around is that it cannot tell the difference between influenza and COVID. Could you clarify this for us?
Yeah, there's certainly no indication that the PCR test for COVID gets mistaken for influenza. Now, there are some tests, and maybe in the US they're using bundle tests, like it's a test that tests for all viruses and gives you positive or negative. If that's the case, it wouldn't be able to tell you which particular virus you tested positive for. That is not the PCR test that we're using here in Ontario. So that may be part of it. I'm not quite sure. But I do think that, it's the same PCR test that we've been using. We have been able to distinguish influenza versus COVID. The influenza PCR test is separate. Now, the piece on PCR tests versus, rapid antigen tests, even in Ontario, if you test positive with a rapid antigen test, consider yourself positive for COVID now, because there's so much COVID that you do not, for those who are recommended to go for testing, that confirmatory PCR test for the most part is not required.
Right, exactly, right. Okay, and sorry, just to confirm, doctor, so in Ontario, the test that we are using, the PCR test for influenza is different from the PCR test for COVID. It's not the same test.
It's not the same test, no.
Okay, right, perfect. And then, okay, AK asks, when can Ontarians get a booster shot without waiting so long? It seems like there's still a lot of backlog.
Yeah, so I think there is continuing to be increases in vaccine capacity, putting more appointments. I think now that the holidays are over, certainly the goal is to get as many booster dose appointments available. Unfortunately, what's happening in the general population is happening in healthcare in general. And so even people who work in vaccine clinic are getting sick and having to stay home. And so it seems to be one of the new problems with for example, opening more clinic appointments is recognizing that there are a lot of staff absences. Yeah. So that is currently playing in right now. But I do know that there are certainly a lot of sentiments to try and get more appointments available to everyone.
Right. Okay. And it's not a supply issue. It's not a vaccine supply issue. It's more of a staff shortage issue.
For the most part, it's availability of human resources. Yeah.
Okay. And then, okay, let's take Kathy's question. My husband and I had friends over for dinner on December 20th. They ended up with COVID later in the night. They took rapid tests, were unable to get a PCR test. We have no symptoms whatsoever, and we feel like we may be wasting the hospital's time to get tested. Any thoughts on this?
Okay, so this was obviously sent over the holidays, and I think what we're finding now is that the testing recommendations are different. So there would be no recommendation to get tested if you had close contact with someone who had COVID. If you are not fully vaccinated and you're 12 years of age and older, you are required to isolate. If you are 12 years of age and older and are fully vaccinated, or if you are under 11, then you do not need to isolate. Those are the new guidelines. There's no recommendation for testing in that case, unless you were one of those specific groups, a healthcare worker working in long-term care, for example.
Right. All right. And then Yvette asks, is it safe for elementary teachers to return to work without a booster shot, given that all of the young students are basically unvaccinated? It's not a very high vaccination rate with elementary kids from 5 to 11.
So I think when we talk about return to school, there are a number of things that we have to think about. So the one important measure that will be in place in schools is that everyone's screened. And so anyone who has symptoms in the school setting should stay home. We're even in some, going to a doctor's office or whatever, if you have symptoms, they're not seeing you in person. There are specific places where people with symptoms are going. So that's the first measure that's going on in schools that's going to help prevent COVID from coming into the school. There's no question that I would recommend a booster dose to anyone who is eligible, including staff who work in schools or wherever they work, actually, especially if they cannot work from home. And then recognizing that there is a role for PPE and wearing that personal protective equipment, keeping that physical distance, all of those other measures, again, are going to help to prevent the spread of COVID in that school setting.
Right. And Doctor, right now we see, of course, kids are doing online schooling for the next couple of weeks. What are we expecting to happen in schools, or what are the extra measures that are going to be taken in schools that will then make them safe in 2 weeks that have not made them safe all this time?
Well, we are certainly waiting for guidance from the Ministry of Health, updated guidance related to schools that has not come out yet. And so, when we have that, we can certainly talk about what else will be in place there.
Right. Okay. Let's take a live question coming in right now from Shane on our website. Shane says, I recently returned from a business trip and I tested positive on a rapid test. I share a home with my husband, and over the past 5 days, I've tested positive while he's remained negative. Before I knew I was positive, we spent all our time together and shared the same bed. But since I've tested positive, we sleep apart and we keep our distance in the home. When will I know if it's safe to go back to normal? I'm asymptomatic.
Okay, so the guidelines are if someone at home has tested positive, or even if they just have symptoms, everyone in the home has to stay home for as long as the person who has symptoms is isolating. Mm-hmm. So then the question becomes, well, how long does the person who has symptoms or who has tested positive need to isolate? Well, that depends, first of all, on if they're fully vaccinated or if they are 11 and under. And if they are fully vaccinated or 11 and under, they isolate for 5 days and can return as long as their symptoms are improving after 24 hours or 48 hours if their symptoms were nausea, vomiting, or diarrhea. If they continue to have a fever on day 6, 7, 8, they have to continue to self-isolate regardless of the vaccination status. Now, if the person who got COVID was unvaccinated, they need, or not fully vaccinated, they need to isolate for a minimum of 10 days. And then their household members will have to isolate for that 10 days as well too. And it could be longer if their symptoms last longer than that.
Okay. And sorry, doctor, just to clarify, I might have missed it. If you are fully vaccinated and above 12, do your household members also need to isolate if you are symptomatic?
Yes, absolutely. Yes. So that is a change, that the vaccination status does not matter for household contacts. So if you live in a home with someone who either has tested positive for COVID or who has COVID, everyone in the household has to stay home for the same time as the person who's isolating is at home.
Okay, all right. Okay, let's go back to our submitted questions. Let's take Wing's question. Is there enough data about the Omicron variant regarding severity and hospitalization? Although it is very contagious, is the virus mutating into a less severe infection like a cold, and can it be attributed to the vaccines?
Okay, so there is certainly more evidence showing that the Omicron variant is less severe, less hospitalizations, less deaths compared to the Delta variant, for example. That certainly is being shown, but it is much, much, much more contagious. So what that means is,
sorry, doctor,
if a million people...
Sorry, doctor, we lost you there for a little while. You said it is much, much more
contagious.
Contagious, yes.
Contagious. And so what it means is that many more people will get Omicron. And so there are still some people who will get very sick, mostly the unvaccinated, but even a few who are vaccinated, which will again end people up in hospital. And I certainly saw that. I worked a lot over the holidays in the emergency department. There are many people who, based on age, noticing 45, 50, 60-year-olds were getting better, 7 days later getting worse and did require some additional care.
Right. Right. Okay. And so when it comes to the virus mutating and becoming less severe, that's part of Wings's question. Is it less severe like a cold almost? And can that be attributed to the vaccines, like because the vaccines are working?
There's no question that if you are vaccinated, you are getting the less severe illness. Yes. So the vaccines, while the vaccines are not necessarily preventing people from getting Omicron, they are, for the most part, getting a milder illness. And if you are unvaccinated, your chances of getting a more severe illness are higher. And so what I actually tell people is, imagine if we had Omicron last year and we didn't have vaccines. How would that look? Like, we would have, most of us unvaccinated, many, many, many more very sick illnesses. So there's no question that even though the vaccines are not preventing us as much from getting Omicron, they are certainly keeping us, for the most part, out of hospital.
Right. Okay. And let's jump into another live question coming from our website. Adrian asks, please confirm daycare for kids under 5 years. Are there any protocols in place at this time or any suggestions for parents? These kids are not vaccinated for COVID-19 and I'm guessing some other diseases as well, he says.
Yeah, so there certainly are the protocols for the staff to wear PPE, to do the screening as well, to ensure. And we are certainly waiting for additional guidance and protocols from the Ministry of Health related to daycares as well. But all of, many of the measures that were in place before the holidays continue to be in place.
Okay. And let's jump back into the submitted questions now. Kim says, my stepdaughter and her boyfriend tested positive for COVID on December 21st, which we believe they got from Chuck E. Cheese on Sunday. She lives with her mom, who tested negative. However, they had the flu, etc. We have kept our distance as my mom is 85 and lives with us. How long should we keep apart? With isolation now only 5 days, is it safe after 5 days to mingle without worry of infecting others?
Yeah, so good question. So actually, the first 5 days, you're in self-isolation. If you're fully vaccinated, your symptoms are improving for 24 to 48 hours, you are released from self-isolation, but you are still not recommended in those next 5 days to go to higher risk settings. So that would be like a long-term care place or a hospital, for example, if you don't have to, and as well not to visit with people who are at higher risk for getting COVID. And so that would include seniors as well.
Right. So it's the 5 days of isolation. And then once you leave isolation, 5 days after that as well, you should be careful.
That's right. And, wear a mask, keep a distance, recognize that that you still need to take additional precautions.
Right. Okay. And then I guess let's move on to Gisella's question. Is it advisable to shorten the amount of time before dose 2 for 5 to 11-year-olds? Should parents consider a shorter time frame now?
Yeah, so it's a good question, and it's really about a balancing act. The National Advisory Committee on Immunization reviewed this before in December, even when Omicron was here. And what we know about Omicron and the vaccines are that 2 doses don't necessarily prevent you from getting Omicron. We know that you really need that third booster dose. That's the one that gives you better efficacy against getting infected. We also know in children, we want them to get the best immune response after that second dose, and we want it to last, because right now there is no recommendation for booster doses. And so while we're right now in the thick of Omicron, actually, the recommendation is to still wait to get that second dose at the 8-week interval, because again, getting that second dose earlier is not going to necessarily prevent them from getting Omicron. The 2 doses of vaccine are not proving to be as highly effective against Omicron. And by waiting, another few weeks, when they get it, they'll get that better immune response and it will last them. And we have to really think beyond Omicron here as well, too. While I know that there's, big hopes that this will be our last wave, it's really hard from a science perspective to be able to predict that. And, we have to be prepared. There could be another wave after this, and we want to make sure that our children especially have that protection where it may make a difference as well too.
Right, absolutely. And Doctor, recently we heard that senior citizens, I believe in long-term care settings, are going to get a fourth booster. So now we saw that with the third booster as well. It started with the vulnerable groups and it petered down to all of us. Does that mean we all get a fourth booster at some point?
It's really hard to know about that. I think when we think about long-term care homes, let's remember that they actually started getting their third booster in September, the end of the summer, the beginning of the fall. And so it's actually been many months since they had their third booster, and they're at very high risk. We know that actually there are a lot of long-term care homes that now have outbreaks of Omicron. And so, and we know that they are a highly vulnerable population. So I don't think we can in any way predict that now everyone's going to need a fourth dose. This is really very specific to this, to being senior. Most long-term care residents are seniors and being very vulnerable.
Right. Okay. And actually another question from Wings. If you test positive with or without symptoms, should you postpone your scheduled booster shot? Will it make you sicker? It took a long time to book the appointment, so obviously people are not looking to postpone them any further.
Yeah, this is another good question. So certainly do not attend your booster shot if you are isolating. And I would certainly recommend that you postpone it for that. This is getting a booster dose while you're sick with COVID is not urgent medical care. And now, in terms of, well, what if it's a week later? I mean, you are certainly eligible to get your booster dose and could get it. You probably have some immunity from a recent Omicron infection, and so you could wait 4 to 6 weeks to get your booster dose after that as well too. There's no real firm, clear guidance here. Really, as long as you're out of self-isolation, you are eligible to get your booster dose. If you wanted to wait an interval, you could wait a few weeks. Really, it's up to you based on your own level of risk. You're booking your appointment, that kind of thing.
Right, absolutely. And I mean, if you're isolating, it's probably best not to go because you might infect somebody else if you are actually positive, right? So,
well, that's exactly why we don't want you to go if you are isolating. Exactly.
Okay, let's jump into a live question coming in from our website. Sarah asks, how come there are no restrictions for churchgoers? Both non-vaccinated and vaccinated can go to church with 50% capacity. Why are the restaurants and gyms have to be closed, but they only have vaccinated customers?
Yeah, so there actually have been capacity limits placed on places of worship with the new updated regulations. And there are certainly, measures that have to be put in place, like physical distancing, masking, and all of those things.
Right. And Doctor, has the no singing rule been brought back?
I will have to follow up on that. I'll have to follow up on that.
That was one of the big things during our very first wave of COVID was no singing in church, no singing, no karaoke, none of that.
Yeah, I think we really do have to recognize, though, that singing, again, with this very highly transmissible variant, is going to be higher risk. It's going to be, and depending upon the kind of mask, it may or may not protect or prevent spread. So again, that physical distancing, good ventilation, maybe singing outdoors would be preferred.
Right. And Doctor, you just mentioned masks, actually, types of masks. We've been hearing a lot of stuff over the holidays regarding double masking, or then moving over to N95s or KN95s, which are sort of widely available online. What are your thoughts on masking and changing up to a better, more protective mask?
Yeah, so definitely. We actually updated our website with the updated Public Health Agency of Canada guidance, even just before Omicron hit. And really, it's about having a high quality mask that fits well. And so again, the fit is really important, right? To make sure that there's no gaping and it covers your mouth, nose, and chin. And then a high quality mask could include a respirator type mask. That would be like an N95 or K95. Even if it's not fit tested, that's a higher quality mask.
Okay.
Otherwise, at minimum, I would definitely say a 3-layer cloth mask. And, you could consider a medical mask, like those blue surgical masks with a cloth mask on top. This is a very, very highly transmissible variant. And so that's why even the guidance for masking has been updated.
Right, absolutely. Okay, we've got a few minutes. I'll just take a couple of live questions from our website here. Yvonne asks, we need to continue to, it might be a statement, we need to continue to tell people Delta variant hasn't gone away. And while the new variant may have less severe symptoms for some people, the number of cases and hospitalizations and deaths are still going up. Yes, Yvonne, that is that is correct. And it's more of a statement than a question, doctor. But if you'd like to reiterate regarding Delta and its prevalence as well.
Yeah, I think Delta is certainly on the way down. We are seeing Omicron, but what we are finding though, like it's not, a mild infection for everyone by any means. It's not, and you can't always predict who is going to get more severely sick. I mean, we know if you're older, if you have a health condition, if you're living in a long-term care home, you might have a more severe illness, but it's not always the case. You cannot always predict it. I've certainly seen some children, young children especially, less than a year, that have gotten quite sick even with this new variant. And we have to remember that now, I mean, we've never seen this number of people getting sick per day, for example, right?
Yes.
Testing positive. We're not doing the same. There is a lot of this virus circulating. And so even a small percentage sick ends up being a very large number by comparison to even Delta.
Right, absolutely. And then let's take another live question. For those that got COVID, when can children ages 5 to 12 get their second shot? And adults with 2 shots already get their booster if they've already had COVID?
Yeah. So as long as you're cleared from self-isolation, again, you could go and get your booster dose. That would be just fine. For children, I would still recommend that 8-week interval. If they got COVID, it would, they're getting it's like a boost, but still get that second dose for sure at the 8-week interval.
Okay. And then let's just do, this is a little bit long-winded, but let's do this anyway. We'll squeeze it in this last minute. Ryan says, I travel often for work. With the new testing guidance, I have a question. As I understand, you can test positive long after having COVID. So if I now get sick and isolate and I don't need to test anymore, my question is around documenting the illness and the recovery, because that is something that's needed to cross the border, but you don't have a test result. So how is that going to be handled?
It's a very good question. And I think that's a question actually for our federal regulators, right? Because it is their regulation. I've also, I also know, though, as you say, like by the federal guidance, if you've had a test that's more than 14 days ago and, you have a repeat positive, they can recognize that. But some airlines may not. They may say if you're positive and you cannot travel. So every level of travel is going to need to follow their guidance. And really, this is a question for the Fed. So hopefully they will help to clarify that.
Yes, hopefully there will be more guidance, especially given that we're not testing like we used to. It's completely changed now. All right, so on that note, it is past 1 o'clock. Thank you so much, Doctor, for joining us once again. We will be continuing these weekly as long as we need to. We've got so many questions that came in that we couldn't get to, so we will carry them over to next week. But for now, we do have to say thank you and bye-bye. Thank you, Doctor.
Bye.